Hello everyone, welcome back to my Nursing Hub. Today in this video we are going to see Rogers' unitary human beings model and its application in the nursing process. Before going into the nursing theory, let's see the credentials and background of the theorist. So Rogers was born on May 12, 1914 in Dallas, Texas. Her college education was from 1931 to 1933 and it was in science at the University of Tennessee. In 1936, nursing diploma from Knoxville General Hospital School of Nursing. In 1937, Bachelor of Science degree from George Peabody College in Nashville, Tennessee. Other degrees include a Master's of Art degrees in Public Health Nursing Supervision from Teachers College, Columbia University, New York, and a Master's of Public Art degrees in 1952 and Doctor of Science degree from Johns Hopkins University in Baltimore in 1954. When we look into her career, Rogers' early nursing practice was in rural public health nursing in Michigan and in visiting nursing supervision education and practice in Connecticut. Rogers subsequently established in visiting nursing service of Phoenix, Arizona. For 21 years, that is from 1954 to 1975, she was professor and head of the Division of Nursing at New York University. After 1975, she continued her duties as professor until she became a professor emerita in 1979. She held this title under her death on March 13, 1994 at 79 years of age. Rogers has published 3 books and more than 200 articles. In 1988, colleagues and students joined her in forming the Society of Rogerian Scholars, that is SRS, and immediately began to publish Rogerian Nursing Science News, a members' newsletter to disseminate theory developments and research studies. When it comes to the theoretical sources, in 1980, she developed the Science of Unitary Man model. In 1983, the Science of Unitary Man model. And in 1986, the Dimensions of Health, a View from Space. Roger was prompted to develop her model because of the need for nursing to have a distinct and unique body of knowledge. She developed the model using a deductive approach, and Rogers' model is an open system model. Now let's see her model, that is called as unitary human beings model. So she is based on her assumptions about the person and interaction with the environment. She uses 4 building blocks to develop her model. That is, first one is energy fields, second is universe of open systems, third is pattern, and fourth is pan-dimensionality. So the first one is energy fields. So energy fields are the fundamental units of both living and non-living things. They are unique, dynamic, open, and infinite. And she identifies 2 energy fields, that is the human field, that is called as unitary man, and the environmental field. So human field is defined as an irreducible pan-dimensional energy field identified by pattern and manifesting characteristics that are specific to the whole and that cannot be predicted from knowledge of the parts. So the human field is mainly, it is identified by the pattern, that is our characteristics, so our emotions, our joys or our happiness. So that depends upon the various situations. So if something happens, good things, and that will make us joy, or if something bad happens, that may make us very sad. So that is called as a pattern, and that is not a specific thing, that may change over time. And second one is environmental field. It is defined as an irreducible pan-dimensional energy field identified by pattern and integral with the human field. So the environmental field is always in connection with the human field. So if there is any changes with the human field, it can affect the environmental field as well. Or same way, if there is any changes in the environmental field, that can affect the human field. So Roger's second concept is universe of open system. So universe of open system refers to the idea that energy fields are open, infinite and interactive. The human and environmental fields are in continuous process and are open systems. So it means always there is an interaction with the human and the environment because both are open system. So the third concept of Rogers' theory is pattern. So pattern is the characteristic of an energy field. It is perceived as a wave that changes continuously, becoming increasingly complex and diverse. The pattern and organization of an energy field are manifested by its observable properties such as human behavior. So as I already said in the previous slide, the pattern is the human behavior or the characteristics. So the human characteristics can be different in each situation. So that is most probably affected by the environmental field. So suppose for example, if there is a birth of a child, that can happen, that can make the people happy. So that is a human behavior. And if there is a death of the person, that can make the people sad. So different situations. So in different situations, the pattern of the person will be different. So the fourth concept of Rogerian model is pan-dimensionality. So it refers to a non-linear domain without spatial or temporal attributes. Its boundaries are imaginary and continuously fluctuating. So the human or the environmental field does not have a boundary. So it is always imaginary and continuously fluctuating. The term pan-dimensional provides for an infinite domain without limit. It best expresses the idea of unitary whole. So earlier this pan-dimensionality were known as four-dimensionality. So in 1992, when she changed the model, she has changed into pan-dimensionality. So that is based on her principle of hemodynamics. Now let's go through the principles of hemodynamics. Rogers views hemodynamics as a means of understanding life and the mechanism that affect it. According to Rogers, hemodynamics can provide a nurse with knowledge of how to intervene to redirect a client in a desired direction. These principles have evolved from Rogers' original work to her current model. In an introduction to the theoretical basic for nursing in 1970, Rogers identified four principles of hemodynamics. Those are resonancy, helicy, reciprocity, which means continuous and mutual interaction between human and environmental fields, and synchrony. So synchrony means simultaneous change in human and environmental fields at a specific point. And again in nursing, A Science of Unitary Man in 1980, she replaced reciprocity and synchrony with complementarity, which means continuous, mutual and simultaneous interaction between human and environmental fields. Again in Science of Unitary Human Beings in 1983 and her current model, Dimensions of Health, A View from Space, she replaced complementarity with integrality. So at her present model, the first principle is integrality, so which refers to the continuous and mutual interaction between the human and environmental fields. Because the two fields are inseparable, both have the same features. As a result, sequential changes in life processes take place at the same time and in the same manner in both fields. These life process changes occurs as continuous revisions. The second principle of hemodynamics is resonancy. Resonancy refers to the continuous changes from lower frequency to higher frequency wave patterns in the human and environmental fields, which means when there is an interaction between the human and the environment, so sometimes some kind of experiences, maybe the loss of job or maybe some kind of somebody's death or something, or if you are angry with somebody, so this mainly depicts the human behavior. So sometimes it is in the higher frequency we may be angry, like when we are angry we may make more voice or more sound. So it depicts the human behavior. It describes the nature of the change that occurs between the two energy fields. Life process changes are depicted as rhythmical vibrations oscillating at various frequencies and at varying intensities. The continuous change from lower to higher frequencies indicates movement toward increasing complexity of the field. So the next principle of hemodynamic is HELICY. It refers to a continuous probabilistic increasing diversity of the human and environmental fields. It is characterized by non-repeating rhythmicities. It describes the nature and direction of change occurring along a spiraling longitudinal axis bound by space and time. So here mainly Martha Rogers focuses on even a small time which we are spending with the patient, that matters a lot. So it is a kind of non-repeating rhythmicities. Like we can see this in more detail when you're going into the nursing care plan. The human field becomes increasingly diverse over time as it incorporates past patterns and develop new ones. So we know when we are becoming old, we may try to incorporate the past patterns, past characteristics which we used to do earlier, and to develop a new one as well. As a person ages, old patterns are not repeated but can recur at more complex levels. Change in the life process are irreversible. Thus, the human and environmental fields are repatterned. Now let's see the Rogers model and metaparadigm. So first one is person. It's otherwise called as unitary human being. Is described as an organized energy field with a unique pattern. Is viewed as a unified whole processing integrity and manifesting characteristics more than different from the sum of parts. Continuously exchanges matter and energy with the environmental field, resulting in life process changes. So here the Rogers mainly focuses on unitary human being, otherwise we called it as person. So here always the person is in constant contact with the environmental field. So if there is any changes in the environmental field, that can results in the their process changes as well. So the person experiences a continuous repatterning from interaction with the environment. Repatterning evolves irreversibility and directionally along space and time, resulting in an increasing complexity and innovative person. So for example, if the death of a person, which is who is a loved one, so that can change, that can make a lot of changes in the other person's life. So but the person will try to change their life as the time passes. The person is identified by his pattern and organization, which reflects his wholeness. Has the capacity for abstraction and integrity, language and thought, sensation and emotion. He can participate creatively in change. Lives in a universe subject to the laws of probability. So the next concept of Rogers model is environment. So we have already seen the human and environment is not separable, and it is described as an irreducible four-dimensional energy field identified by pattern and having characteristics different from those of its parts. It is considered to be all that is external to the unitary man. A specific environment field exists for each human field. So most of the time we know our house or our the place where we are staying, that is our environmental field, or the person whom we are in constant contact, they will be our environmental field. So and it is an open system. It is infinite. Environmental change is continuous, creative, probabilistic, and mutual with the human field, and is characterized by increasing diversity and complexity, and is identified by continuously changing wave patterns. For example, for a patient, those who are admitted in the hospital, the environment is the hospital for them. Otherwise, when we are in the home, it is our environment is our home. So in the hospital, the patient may see many people, the doctors, nurses, or other healthcare workers. Everyone will be an environment for them. So how the patient is contacting with these people, so that will be depends upon the person's wellness. The next concept is health. So it is an expression of the life process. They are the characteristics and behaviors emerging out of the mutual simultaneous interaction of the human and environmental fields. Health and illness are the part of the same continuum. The multiple events taking place along life's axis denote the extent to which man is achieving his maximum health potential and vary in their expressions from greatest health to those conditions which are incomparable with the maintaining life process. So here we already say, so for a person, the person who is in the hospital is, for example, the patient, we can say that it as a patient. So the patient is a human or the person, and the environment will be the hospital or the nurses or the doctors or the whoever in contact with the patient. So that is environment, and here the health is how these people are interacting with them. So that is the health. So it is a characteristics and behavior emerging out of the mutual simultaneous interaction of the human and environmental fields. How we are interacting, how the nurses are interacting with the patient. So sometimes some kind words will be enough for the patient to get a good healing, especially when they are in some kind of sad situation, or in kind of depression. So in those situations, a kind word will be enough for them. So how we are interacting, so as a nurse, it's our responsibility to give a good health to our patient. So the next concept is nursing. So nursing exists to serve people. It is a direct and overriding responsibility to the society. The safe practice of nursing depends on the nature and amount of scientific nursing knowledge the individual brings to practice, the imaginative, intellectual judgment with which such knowledge is made in service to the mankind. The main critics of this nursing model is, first one is clarity. So there were early criticisms of the model with comments such as difficult to understand principles, lack of operational definitions, and inadequate tools for measurement. However, the model has passed the test of time for the development of nursing science as nursing matured as a science. Now let's see how can we apply this nursing model into the nursing process. Now let's see the identification data. So here the name is Mrs. James, as as we have seen in the other videos. Age is 72 years, female, and her date of admission is given there, and her marital status is she is a widow and has 2 children, but they are living away. Religion is Christian, the language is English, occupation is she is a volunteer worker, and her interests are gardening and active in clubs, and her diagnosis is CVA, which is left-sided. The chief complaints includes left-sided weakness, but the other thing is she is left-handed. Her personal and social history includes she lives in her own home, now in a 4-bedded room, frequently reports difficulty in sleeping in the hospital. Until she was hospitalized, she slept 6 to 7 hours a night, has incontinence at times, needs assistance in bathing, feeding, etc. She misses her friends and describes herself as mess. She believes in independence, likes to interact with her own age group. When it comes to the nursing process, the steps includes assessment, nursing diagnosis, intervention, implementation, and evaluation. So first we are assessing the Mrs. James condition. So here focus is on collecting data and opinions about the person and the environment relative to principles of integrity, HELICY, and resonancy. That is how Mrs. James interacting with the hospital environment. She reports difficulty in sleeping in the hospital. Until she was hospitalized, she used to sleep 6 to 7 hours a night, and she was very active and she used to do the gardening. So here we can see the nursing diagnosis. So it relates to the rhythms, patterns, and life process and reflects the principles of hemodynamics, that is alteration in sleep pattern. When it comes to the planning, so here we have to focus on promoting dynamic repatterning with regard to alteration in Mrs. James' sleep pattern. So plans are to provide an environment conducive to sleeping, increase activity during the day based on Mrs. James' previous lifestyle, use relaxation techniques to promote readiness for sleep. And comes to the implementation, so here you can carry out the strategies necessary to strengthen the integrity of the individual environment relationship. So we need to ask Mrs. James to tend plants on unit, thus increasing walking and providing a purpose, air and soothe her bed, use appropriate pillows, fix her knees to reduce any pulling on her back muscles, practice relaxation techniques with her. And in the evaluation, it relates to optimum state of health, that is, what is Mrs. James's pattern of sleeping by the 3rd day following nursing implementation. How long is she sleeping? How well is she sleeping? Does she wake at night? Does she need sleep medication? And how does she feel and look? So hope you understood the Rogers nursing model. So from the nursing process itself, we can understand how we are going to apply this thing into this model or this nursing paradigm into the nursing practice. So thank you for watching my video. Please like, share, and subscribe to my channel. Thank you.